Proposition 56. Cigarette tax to fund health care, tobacco use. Prevention, research, and law enforcement. Initiative constitutional amendment and statute. Plain language, raise taxes on tobacco products. What does it do? It increases the cigarette tax by $2 a pack, with equivalent increases on other tobacco products and electronic cigarettes containing nicotine. It uses the increased tax money primarily to fund existing healthcare programs, but it also makes provisions for spending on tobacco use and prevention control programs, tobacco-related disease research and law enforcement, University of California physician training, dental disease prevention programs, administration. It excludes the added revenue from the Prop 98 education funding calculation requirements for schools. It replenishes tax losses to existing tobacco-funded programs and sales tax revenues if this proposition leads to decreased tobacco consumption. It requires a biennial audit. People consume tobacco in various ways. Cigarettes, the most popular, cigars, chewing tobacco, and other products that contain at least 50% tobacco, and the new kid on the block, e-cigarettes. These products are triple taxed, as noted here in the legislative analyst figure number 1. As you can see, the federal government levies an excise tax on tobacco wholesalers of $1.01 a pack. The state also levies an excise tax on tobacco wholesalers of 87 cents a pack, and the state and local governments charge sales taxes to tobacco consumers. E-cigarettes are the exception to the rule in that they are not subject to excise taxes. Currently. The current cost of a pack of cigarettes in California is about $6 plus tax. In 2015 through 2016, for example, the state excise tax brought in about $800 million in revenue, and the state sales tax brought in about $400 million. That's $1.2 billion. But where does this money go? Let's not get mired in the details, but it goes to the state governments, it goes to local governments, it goes to tobacco education programs, it goes to health care for low-income Californians, it goes to breast cancer funds, it goes to early childhood development programs, stuff like that. Long story short. So Prop 56, what does it do? It cracks the whip on tobacco taxes. Tobacco products are sold in different quantities depending on the product, so for the sake of simplicity, the legislative analyst has converted everything using a pack of cigarettes as a unit. Prop 56 would increase the cigarette tax by $2 a pack. Cigars, chewing tobacco, etc. would also be raised by the equivalent of $2 a pack. E-cigarettes will also be raised by the equivalent of $2 a pack. Where will all this tax money go? Let's look at figure number 4. Because of this ginormous, fat, juicy tobacco tax, it is expected that many tobacco users will reduce tobacco use or give it up altogether, which means less tobacco tax money, which means programs that currently rely on tobacco tax money will suffer. So this is how Prop 56 will go. The first of the Prop 56 tax revenues will go to replace lost revenue for these programs hurt by the law. Then from what's left, 5% of that will go to government administration costs to administer the tax. After that, $48 million will go to tobacco law enforcement, $40 million to the University of California physician training to increase the number of primary care and emergency physicians in California, $30 million towards dental disease education and prevention, $400,000 towards auditing agencies receiving this money, and finally, from what's left after all that, it will be divided as follows. 82% to Medi-Cal, aka funding healthcare for low-income Californians, about 13 million people. 11% to tobacco prevention and control programs, 5% to cancer disease research, and 2% to programs to prevent and reduce the use of tobacco products by young people. Fiscal impact. The fiscal impact of Prop 56 would be $1.3 to $16 billion in new tax revenue for the state. Tens of millions of dollars from including e-cigarettes and excise taxes, $1 to $1.4 billion in revenue for state health programs, potentially neutral impact on sales tax revenue, and increased funding for tobacco law enforcement. If you would like to stare at details, see Figure 5. As a final note concerning fiscal forecasting, the legislative analyst highlights 2 possible reactions to the possible passage of Prop 56. 1. Prop 56 could reduce healthcare costs if tobacco users reduce tobacco use as a result of this, and thus reduce the need for tobacco-related healthcare. This would save money. But 2. Many tobacco users may then live longer and then rack up old age-related healthcare that they wouldn't have needed if they had died younger from tobacco diseases. This makes me wonder if tobacco users should just die according to schedule rather than complicating the tax system by quitting and then living too long and then just messing up all the actuarial tables. Just die when you're supposed to, smokers. Jeez. From Yes on Prop 56. Prop 56 will keep kids from smoking and reduce tobacco-related healthcare costs. Each year, tobacco causes more deaths than guns, car accidents, HIV, alcohol, and illegal drugs combined. Big Tobacco opposes Prop 56 to protect their profits at the expense of future generations. Prop 56 is merely a user fee. Smokers will help pay their fair share of healthcare costs instead of leaving it to taxpayers to foot the bill. It's about fairness. Prop 56 includes tough transparency and accountability measures, built-in safeguards, independent audits, strict caps on admin costs, and prohibits politicians from diverting funds for their own agendas. Prop 56 doesn't take a dime from schools. Chris Unger, the president of California School Boards Association, says, "We have carefully vetted Prop 56. It protects school funding while helping to keep our kids from getting hooked on deadly addictive tobacco." From No on Prop 56. We all want to help those who want to stop smoking. But Prop 56 is not what it appears to be. Prop 56 is a $1.4 billion tax hike grab by insurance companies and other wealthy special interests. It allocates just 13% of new tobacco tax money to treat smokers or stop kids from starting. If we are going to tax smokers another $1.4 billion per year, then more should be dedicated to treating them and keeping kids from starting. Instead, most of the $1.4 billion goes to health insurance companies and other wealthy special interests. Insurance companies and other healthcare providers get 82% of this new tax, and over $147 million will be spent annually on overhead bureaucracy. California's Constitution, through Prop 98, requires that schools get at least 43% of any new tax increases. Prop 56 was purposely written to undermine our Constitution's minimal school funding guarantee, cheating our schools by deceptively diverting at least $600 million a year from schools to health insurance companies and wealthy special interests. Not one penny of the new tax will go to improve our kids' schools. Prop 56 doesn't solve problems facing California families. We have many pressing problems in California, like fully funding our schools, repairing roads, solving the drought, and fighting violent crime. If we are going to raise taxes, we should be spending the new tax revenue on these problems. Just getting my last smoke in while it's still affordable. Just a second. Okay. So, I'm voting no on this. It's not really an emotional issue for me, so let me just rattle this off and move on. 1. I don't think this has anything to do with tobacco health care and protecting our children. All that babbling is just a smokescreen for what they really want, which is 2, to dump yet even more money into the ever-failing Medi-Cal program. This is the third proposition trying to funnel cash into Medi-Cal. The pro-argument touches every red herring except what this is really about: funding the healthcare system. It's another proposition pretending to be about bringing back happiness and joy, but really it's just, we bit off more than we can chew with this healthcare scheme and now we can't afford it. And 3, that's why so little of this money is actually going to tobacco causes. 4, smokers already pay ridiculous taxes. Now this is just going overboard. The claim that smokers need to pay their fair share is absurd because they do. Secondly, that charge is only applicable to Medi-Cal smokers, but anyone else is already paying this fair share and still covering their own health care and still being taxed to pay for other people's health care. And so 5, more taxes, California. What a surprising twist this election. Who saw that coming? More taxes. 6, more polemics. One side complains about the big evil tobacco companies, and the other side about the big evil insurance companies. Yawn. As a side note, the No on Prop 56 people keep saying that this takes money from our schools. No, not really. It just keeps schools from getting more money, since technically the California Constitution requires that schools receive a cut of any new tax revenue. But somehow the writers of Prop 56 wrote the law so that this doesn't happen, which I'm surprised they can even do that. If you vote yes on Prop 56, you are voting to raise tobacco taxes to generate funds for various purposes. And if you vote no on Prop 56, nothing changes. The Darryl Johnson Show says no on Prop 56.